I want to talk about a subject that's near and dear to my heart. Fibroids. Yeah. First off, fibroids are little growths of fibrous tissue that grow inside of the uterus, okay? So it can go in many different parts of the uterus, as you can see here, okay? Many different parts here. We're going to talk about where they all actually grow. So there's this thing called the FIGO classification systems of fibroids, and here it is here. It's not cancer, it's just classifying what kind of fibroid it is and where it is. And I apologize, some of the numbers are cut off over here, but we'll get there. So there are fibroids that are pedunculated inside of the uterus. They are submucosal, meaning that part of it is pushing in on the inside portion of the uterus. There can be some that are what called intramural, meaning that they're just in the muscle of the uterus, or some other ones called subserosal. You can't see them because they're over here, but they're pushing out on the outside of the uterus. So you may be asking yourself, why does this even matter? There was a New England Journal of Medicine article that talked about fibroids, and here they talked about what the big clinical issue is. In the yellow, it's talking about bleeding, right? That fibroids can cause heavy bleeding, prolonged menstrual bleeding, anemia from bleeding for a long time, fatigue because you're anemic and you're bleeding for a long time, pressure, and even menstrual and non-menstrual pain can make pain during periods worse. But wait, there's more. It can also cause this compression of surrounding structures, or what we call bulk-related symptoms, like constipation, urinary frequency, and even painful boom boom, you know? So it's not only important to know how big your fibroids are, it's also important to know where they are, if they're pressing more on the inside portion of your uterus, which makes bleeding much worse, or if they're more on the outside, which causes more of this, like the red highlighted area, compression symptoms. This is long, but I hope this is helpful, and this is just a tiny little bit of fibroids and what you need to know. So hopefully this helps you. Have a good one.